We need our pediatricians to stop getting bonuses for vaccinating our children.
They're actually costly. Practices have to buy, store, and administer vaccines under strict temperature controls using expensive equipment. And here's the kicker. Insurance reimbursements often barely cover those costs. Remember how hard it was to find COVID vaccines for your kids? Maybe not for you if you're watching this and you don't vaccinate, but that's because vaccines are expensive to store and maintain. Many concierge or private practices can't afford to stock them and refer patients to federal programs instead. So if vaccines were making us rich, wouldn't we all be rolling in cash? Spoiler alert, we're not.
I learned that the incidence of HPV-related cancers is very low at 0.001%. I learned it has never been proven that the vaccine prevents any cancer.
So the HPV vaccine will prevent not just those life-threatening 36,000 cases of HPV cancer, or 90% of those that the vaccine will prevent. It will also prevent the vast majority of cervical precancers and other precancers for the other HPV cancers. So anal precancer, vulval precancer, vaginal precancer.
Yet everything changed at 13 months, the day he received the MMR vaccine, the only one on the schedule back then. That day I walked into the doctor's office, trusting the advice of professionals who emphasize the importance of vaccinating against deadly diseases. But the nurse reassured me that the MMR vaccine was essential. Like any diligent parent, I followed these instructions. Hours after the vaccination, Billy's perfect world shattered. When my husband came home that afternoon and went to check on him, Billy was convulsing, his tiny body gripped by seizures. We rushed him to hospital, desperate for answers, but the doctors, after hearing he'd had the MMR, said, "It's perfectly normal, it's perfectly common. Lots of children have seizures. He'll be fine. Antibiotics, Tylenol, he'll be fine." But he wasn't fine, and he's still not fine, age 29. He's severely sick with severe autism.
Parents could say reasonably, look, my child was fine, they got this MMR vaccine, and now they're not fine. Now they have autism, they have signs and symptoms of autism. Could the vaccine have done that? The good news is that's a scientific question. 18 studies done in 7 different countries on 3 different continents involving hundreds of thousands of children and costing tens of millions of dollars to look at groups of children who either did or didn't get the MMR vaccine, making sure that those 2 groups were alike in all other aspects: healthcare seeking behavior, socioeconomic background, medical background, so that you could isolate the effect of that one variable, receipt of MMR vaccine. And study after study after study, now 18 studies have shown that you're at no greater risk of getting autism if you got the MMR vaccine or if you didn't.
You can't just look at one vaccine and one component and then wave your pixie dust and say they're safe. That is just not a fact, and that is just not how science works. The CDC scientist who was the lead scientist, lead epidemiologist on this MMR study was Dr. William Thompson. He came forward to me in 2013 through a series of phone calls, and we were in close contact for 10 months. What happened was he found the African-American effect, that African-Americans were over 200% more likely, and African-American males over 300% more likely to get an autism diagnosis if they got the MMR vaccine on time versus if they were received the vaccine after 3 years of age.
In 2014, Brian Hooker, a biochemical engineer without formal training in epidemiology, published a reanalysis suggesting that African American boys who received the MMR vaccine before 36 months of age faced a significantly increased risk of autism. This study was retracted within months. The journal cited undeclared conflicts of interest and serious concerns regarding Hooker's methodology and statistical analysis. Editors stated that the conclusions could not be considered reliable. Hooker's analysis drew from a prior CDC study, which found no association between MMR vaccination timing and autism diagnoses. His reanalysis misapplied statistical methods and relied on selective subgrouping, techniques known to generate false positives. Additionally, there is no biologically plausible mechanism by which MMR vaccination would increase autism risk exclusively in African American males. As a result, the journal Translational Neurodegeneration removed Hooker's article from the public domain. The editors cited serious concerns about the validity of its conclusions and emphasized that its continued availability would not serve the public interest.